Good afternoon. Good afternoon. Thank you so much for joining us today. My name is J.M. Triplett, and I am the Faith and Justice Organizer here at Equality, Ohio. Give me just a moment here. Having some technical difficulties, and we'll get right along the way. All right, so there's my picture. So good for you to be here today. Before we begin with this wonderful webinar, I want to talk a little bit about who we are and what we are here to do. So, Ohio Health Modernization Movement, we are a coalition of organizations and individuals dedicated to ending the criminalization of HIV in Ohio. We are mobilizing a broad coalition, including individuals and communities who are disproportionately impacted by HIV, to replace fear-based, stigmatizing laws that criminalize HIV status with evidence-based, non-discriminatory laws that protect public health. Organizations that are part of OHM include AIDS Task Force of Greater Cleveland, AHF Ohio, Canopy, Caracol, Equality Ohio, Equitas Health, and the University of Toledo College of Medicine. What to expect today? You will learn about Ohio's HIV modernization efforts. You will also understand why we need modernization now, understanding why we introduced HCR 39, and understand how you can use HCR 39 to help educate about the need to modernize the criminal code. So these are our goals today. We want to learn about the urgent needs to modernize Ohio's HIV laws. We want to understand why we introduced HCR 39, and to be able to use HCR 39 to educate about why we need to modernize Ohio's HIV laws. These are our hashtags. Please feel free to use our hashtags when you're making any comments, taking any photos, or anything to do with the modernization of HIV laws. We really want to create a community that we can have communication with. We can also go on our website, ohmodernizenow.org, and pledge your I'm In campaign. And this is a little bit how our website looks, so come and join our cause. We're doing a lot of great work, and we would love to have your voice as part of the work that we're doing. I want to introduce our speakers for today. One of our speakers is Shelly M. Turner. Her mantra is a diagnosis no longer means a death sentence, and people live and thrive with HIV. She is an HIV advocate and prevention health navigator for Equitas Health. Shelly Turner was raised in Butler, Pennsylvania by her grandmother, grandfather, 8 aunts, and 7 uncles. She moved to Youngstown, Ohio to attend Penn Ohio College, where she graduated with an associate's degree in medical science. In 2004, Shelly continued her education journey, attending Youngstown State University and obtaining a bachelor's degree in marketing and a minor in business. In 1997, Shelly was diagnosed with HIV. Due to stigma, she spoke only of her diagnosis with her family and others who are also people living with HIV and AIDS. For the next 20 years, she raised her 3 daughters and continued life with a secret only a few knew, finding love in community work and events that focus on health and wellness issues and better access. In 2019, after years of encouragement from mentors and case managers, Shelly accepted a position as a Northeast Ohio Prevention Health Navigator for Equitas Health. Shelly also began the Sassy Paz Sisters Empowerment Group to create safe space for HIV-positive women. Shelly Turner serves multiple committee boards, such as the OHMM Communication Committee, the WT4AC Advisory Council, and the WWT4AC Committee member. Shelly honors these connections, which allows her to empower, educate, and fight stigma with people living with HIV, helping modernize HIV criminalization laws by focusing on the solid progress of HIV care. Welcome, Shelly. We're so glad to have you with us. Also, we have Katherine Poe, a policy organizer here at Equality Ohio. Katherine Poe, they, she pronouns, joined the Equality Ohio team in 2021 as a public policy organizer. They received their Bachelor's of Art degree in creative writing from Capital University, with a focus on health policies, bioethics, and disability studies. Katherine has volunteered with organizations such as Be the Match, T1 International, and the Arthritis Foundation on Rare Disease and Healthcare Advocacy in Ohio. They are excited to join the Equality Ohio policy team to help organize Ohio for better LGBTQ+ protections. welcome our speakers today. At this time, I'm going to relinquish the floor to Katherine, and she'll take over from here. Welcome, Katherine.
Hi, everyone. Thank you so much for coming today. I'm so excited to get to discuss this really exciting development with a new resolution with you today. So first off, we're just going to start with a little bit of an overview about the resolution. So as you can see on screen, this was introduced by Representative Dr. Beth Liston, who I actually interned for previously in college. Representative Liston is just such a strong advocate for public health at our state house and has really just taken so many initiatives, and we are so blessed to have her as a proponent of our issue. She introduced the House Concurrent Resolution 39 earlier this year on World AIDS Day, December 1st. And that bill has been put in committee to be heard. It is in House, State, and Local Government Committee. As you can see, this is the list of co-sponsors, many of which are actually on State and Local Government Committee, which is really great. And this is a co-sponsor list of mostly Democrats. However, it is a strong list of people. And like I said, many of them are on the committee that will end up hearing this bill. So what is a concurrent resolution? So a concurrent resolution does not make law. This is simply a recognition by both the House and the Senate that this is something that the legislature wants to focus on, that they care about, and that they support. How this basically works is it is introduced on the House side, which is why it is a House concurrent resolution. And then once the House chamber votes on it, after it moves through the committee process, this bill is then concurred by the Senate side. And it basically just is a statement by the entire legislature as a whole. Like I said before, it doesn't create law. But these resolutions can be really strong vehicles to move issues forward and to kind of bring attention to them from an educational standpoint, which is really the reason why this was introduced in the first place. It's a good way to get lawmakers familiar with the issue, to get them behind the issue, and kind of think about concurrent resolutions as a sign-on letter. It's a really great way to get everyone on the same page before a larger piece of legislation is put out into the world, so that people already kind of know what they're going to be asked to do. So as I've said before, this bill is being put in the House, State, and Local Government Committee. This is the chair, Representative Scott Wiggum. So the chair's role of all of this, and I can kind of just walk you through the legislative process. A bill is introduced. It is assigned to a committee by leadership. And every single bill that is assigned or introduced in the Ohio legislature gets one sponsor testimony hearing. That hearing is constitutionally mandated, and the chair is the person that oversees all of the committee hearings moving forward. The chair is also really the person that gets to decide if a bill moves forward from the initial first sponsor hearing. And this person has a really strong position about moving it through the process. And it's often who we target when we're trying to get a bill to move. So in the future, if you see calls to action that specifically have his name, that is why. He is one of the key decision makers on this process, especially when it comes to the testimony process, which will happen later on down the line. So what does HRC say 39, and why did we include it?
Why did we do it? We did this to recognize December 1st as World AIDS Day. To recognize that for 40 years, we wanted to pretty much educate. We wanted to do this before we sent something else to the bill to be passed. We wanted to take this day to educate people on HIV and AIDS. So what we're really talking about is recognizing World AIDS Day now so that we can educate people to know that this is still occurring. This is AIDS. A lot of people, when I'm out in the community and stuff, a lot of people think that HIV AIDS is gone. It's not still is people are living longer and it's not relevant anymore, but it really is relevant to a lot of communities. It still affects a lot of them. So what we're doing is trying to recognize this day to kind of educate more people, to try to kind of bring up to date. Is that what I'm trying? I think I was trying to say, bring up to date, things. So, like I said, World AIDS Day is first being recognized. It was like since 1988. This is 2021, and we still treat HIV like it was 1988. 1981. That's 40 years. That's a long time. But the Center of the CDC reported that 5 classes of human HIV, human immune deficiency virus, and HIV/AIDS, AIDS, they are different. They are totally different. When a person is diagnosed with HIV, a person is, they're letting them know, like, hey, you have a disorder in your bloodstream. So you need to kind of, get that taken care of, getting the treatment. So when you get into treatment, people who get into treatment faster tend to adhere to it, tend to, their viral load goes down. I'll talk more about that later. But a person who is AIDS diagnosed, their viral load is out of control. They're not taking, they acquired another disease to get them sick, like pneumonia. A lot of people affiliate pneumonia, dying of pneumonia with HIV because you get another disease. Sorry, I'm not explaining it a little bit better. A little nervous, but HIV is the virus that, and then AIDS is caused from that. HIV AIDS is caused from that. There's 2 totally different things. People don't die of HIV. People die of AIDS. People die of things that they acquired by being HIV positive. So that's the difference between that. There's more than 6,700 people that have died of complications regarding AIDS. Because you get, when you die of AIDS, you have died of some complications dealing with HIV. Since the epidemic, but including the reason we're here today is really to let people know about Ohioans. Over 14,000 people, Ohioans, have died of AIDS. The other reason I am here is because how it affects different communities. HIV affects different communities, I think, because of affects Black communities and Latino communities 10 times more, 3 times, more than it does white communities. And I think that what I've been learning is the lack of education. A lot of people don't know what World AIDS Day is until they really don't know what it is. They really don't know why we still handing it. These people dying of AIDS, they just don't know what World AIDS Day is. So educating the Black community and the Latino community in the state of Ohio, and people in legislators, lawmakers, and community leaders, educating them about World AIDS Day and HIV and stuff, and let them know that it's still relevant out there and why we're doing it. Like I spoke on, you can read these slides and stuff, but I spoke on already about the disproportion between HIV and AIDS among Black, Hispanic, and Latinos in Ohio. Men who have sex with men, our youth are being affected because they don't have the sex education they used to have in the schools. A lot of them don't even know about it. We have a lot of Ohioans who I'm so upset about it. I keep on repeating this, but they just don't know. They just don't know. Are transgender, and a lot of our injectional drug uses. If you have a community that is a high community of drug epidemics in Northeast Ohio, I have that in a lot of our counties and stuff. They don't realize that a lot of my health workers say, well, syphilis is right there, HIV is right behind it. And they don't know that. And it's not, you're correct. It's not a death sentence anymore. But if we don't get people into care, then it can be. It can be. If you're not doing testing in the right areas or setting an education in the right areas, a lot of people are maybe walking around with it and don't even know it. So they're transmitting it and without even knowing it. So educating them on some simple education of HIV 101 is easy. I mean, it can be easy. And definitely just unfortunately the risk of getting HIV in the sex workers or sex trafficking we have here in Ohio. A lot of I hear about our sex trafficking, the people getting arrested, and then if they're HIV positive, it's just skyrockets their punishment. It's skyrocketed. But this lack of education is everywhere. Today was the CDC estimate that more than 1 million people in the United States were currently HIV positive, including 2,500 in Ohio. That's enormous. That is enormous in Ohio. To know that there's 25 people in Ohio that may be infected or at risk being affected. It's crazy. It's just 2022, and people are still. I literally, like I said before, I literally had people coming to me and say, "I thought HIV was cured." It's not cured, but there's medicine out there. If you get into treatment immediately, there's medicine that can make you live longer. There's medicine that if you take it on a regimen basis, you can be undetectable. There's medicine but if you don't take it, it's more detrimental to your health. It truly is. The national ending of HIV epidemic goal is to reduce HIV infections to 90% by 2040. I hope that we can do it before then. I'm hoping 2040 is a long time away, and I don't know if we'll be here by then, but I hope and pray that we do it before then. With diagnosed newly people being diagnosed, getting into treatment. And then I'm in prevention. I do a lot of community outreach as far as educating about how not to get HIV. Being an HIV positive person, a lot of people are like, wait a minute, how not to get it? How can we not get it? Educating our kids, educating our community, educating our older folks who are, a lot of women. I work with a lot of women who are out of the age of childbearing years, and they feel like, oh, I don't need to worry about protection and stuff. Oh, no, you do. Yes, you do. Because there's things out there that like I tell them, there's things out there that you cannot even get a shot for. So I'd rather, if you're still, anybody who's sexually active, I talk to them about PrEP. I talk to them about how to have that conversation about safe sex, how to have the conversation before you have sex. You can't talk about, well, I don't like condoms right in the midst of intercourse. And you're like, wait a minute, I didn't know you didn't like that. So, it's very important to end the epidemic is diagnose, treatment, prevention, and how we respond to it. How is our community and our lawmakers, how are we responding to it? Because we cannot go to the next level to adjust the laws if we don't understand what we're adjusting. We need to know, if you read the laws about HIV, the felony assault, it is crazy. It's crazy. And we're not going to end an epidemic by just throwing some laws in there. We're not going to do it. We're going to do it by diagnosing people that are HIV positive out here, getting them into treatment, talking about prevention, really talking about prevention, and doing the response, how we're responding to it. If you find out there's an epidemic or a syphilis epidemic going on, you need to get over there and do some HIV testing. You need to find out what's going on over there. Why, talk about it. Get into those communities that some people are a little bit leery about going into. You have to. Ground rules is the only way that we're going to get in there and end this epidemic. As I talked before, the Ohio Department of Health Administrators funds the convenes and works groups with Ohio counties to guide local planning activities. And that is so true. I have seen in 20 years that I have been diagnosed, I've seen more prevention. I've seen more people getting into treatment. I've seen people getting out of care, back into care, and I've seen that, and it's awesome. That's cool, because then we have a lot of people, we have an aging group of people aging, and I'm in there explaining to my doctor, because he doesn't know what to do. He's looking at me like, yeah, this is new to me too. Hey, what's new to me too? Well, come on, let's just ride. As long as I'm keeping I'm taking my medicine, I'm doing what I'm supposed to do. I'm educating, not only that, and I'm cool with asking questions. Ask me all the questions you want. Please do, because I love it. Because if you're asking questions, you're going to take that information back to your community and educate somebody else. You know, I don't like when people say, oh, you can still get it on the toilet. You never can get it on the toilet. I don't know where people got that at. But the planning of the activities are awesome for Ohio. The diagnosing people early, the getting them into treatment, it's all combined. Okay, whereas Ohio has the ability to continue building upon advancements. For the last four decades of effectively ending the HIV epidemic, and we are. The 134th Assembly of the state of Ohio must acknowledge. I'm just trying to, help you guys out with reading, support, help me reading and stuff. So, I mean, we need that, everybody needs to be on the same page. And I believe that by being on the same page, we need to have science, the law that we have now catch up to the science that we have. HIV is not a death sentence anymore. It's like saying to somebody, you have cancer. What are you going to do? Go into treatment to stop that, to kill it, or or you have diabetes. You're going to take the steps to adjust your life to live longer. But it's not a death sentence. I've seen a lot of people pass away with COVID the last couple of years, and it's terrible. And but people are taking vaccines now to prevent that. You can take preventive measures to stop getting it, to get HIV. You can do that. You can take measures to get your viral load undetectable. Taking your medicine. There's just all things that we can do, but the law definitely has to catch up to the science. Definitely. I'm sorry, I'm trying to read some of the comments, so I'm all excited. In recent years, as you can see from the slide and stuff, recently clinical evidence has firmly established that people living with HIV who achieve and maintain undetectable viral loads, as we're talking about U equals U. U equals U means undetectable, means untransmittable. If you have a viral load, I think it's considered a viral load under 200, you're considered undetectable. What that means is that you cannot transmit that disease sexually to anybody else. That's what U equals U means. If anybody has any questions, more additional questions about U equals U, please put it in the chat. We also have PrEP. I'm a big component of PrEP. Big component. I'm really trying to reach out to the Black community as far as PrEP, because in the Black community, a lot of people don't know about PrEP. I think it's a lack of maybe how they advertised and marketed PrEP first, because right now, in the last couple of years, I've been trying to diminish a lot of the myths about PrEP. PrEP is a 99.9% effective if taken on a daily basis to prevent the spread of HIV. You cannot contract HIV if you were taking this on a daily basis. That is remarkable. That is remarkable. That would have probably stopped the epidemic if they would have came back in the 80s when that would have came out then. But we're here now. We're talking about the here and now, and PrEP is really big. So getting on PrEP if you're sexually active, I don't care who you are, is a good arsenal in our toolbox. Comprehensive approach for ending the HIV epidemic in Ohio requires removal of barriers, implementing effective diagnosed treatments. That is so true. Stigma as well as HIV. Stigma in the HIV criminalization law is, I hate to have it hand in hand, but it truly is. People, when you think of HIV, stigma on it is the top of the thing. People don't want to know about it. People don't want to hear about it. People don't want to, it doesn't affect them. It does affect you. Stigma stigma will, I always say stigma will kill the Black community, because if they feel a certain way about it. I wanted to take away the stigma and make HIV just a regular conversation. Criminalization and stigma, it equals together. And until we get that law under control, then we can combat the stigma. I think once we take that HIV criminalization law away in Ohio, or revise it, modernize it. Once we do that, then the stigma will go away. I think testing will increase. I think our people in treatment will increase, and prevention will increase. Because it's just going to be a regular conversation that you have. It's not going to be added like a stigma anymore. That we will do. 134th General Assembly of the United States, Ohio, acknowledges that 40 years, I can't believe it's been 40 years. 40 years anniversary at the first reported cases of HIV 40 years ago. That is unbelievable. And committed to combating stigma. You have to, I think once the law is modernized, I think that it will decrease the stigma. That definitely would, I do believe that. And then a lot of people, when, it gives a lot of people who are HIV positive, stigma, like I said, I lived with it for 20 years. I didn't want anybody to know what I was going through. Even my closest friends didn't know what I was going through. And I didn't have anybody to talk to. But when I get around people who are like me and talk and stuff, it's like, it's such a relief. It is such a relief just to talk about it. So I am.
Well, Shelley, I want to talk about it a little bit more, and I want to invite Katherine back to the screen, because you spoke about stigma, and if you would like, I know in your bio you talked about how you lived for many years without speaking about it because of that stigma. Why is this conversation important to someone like you that has overcome stigma and now becoming a champion for others? Why is this resolution important in your understanding?
Educating them about what the day is about, educating them about where we come from, educating them about, different parts of HIV, U equals U, just different parts of it, just the education part. I think that's a lot, a greater tool to ending the HIV epidemic. I think that for me, it was just so, I didn't want anybody to, it wasn't about me, it was more about my daughters. I didn't want anybody to mess with my daughters. I wanted them to experience school without having their mom status over top of them, and I was able to do that because a lot of their friends didn't know anything about it. They weren't teased or anything about it. They weren't, but now they look at it like, well, Miss Shelley, if you would have came out before, let us know, but it was the stigma. It was the stigma not wanting to let anybody know what I had to deal with, what I had to go through. So I just kept it moving every day. But I think now, the reason I do it now is because to prevent that stigma, to stop people from feeling that way, and to stop them from, feeling that they're all alone, to stop them feeling that they're the only ones there. That's why I do it. That's to educate them. I want our lawmakers to be educated before they just up and pass anything, and see how it affects people. It affects people's relationships. This law, criminalization, HIV criminalization law, it does affect so many people's relationships. People are afraid to have a relationship because I'm not going to tell that person. Wonder if they take it and run with it. That's pretty much it. Education. That's exactly why I want this day to be passed.
Well, thank you so much for that, Shelley. Stay on because we got questions that's coming up. But Katherine, I want to dovetail right off of that, and I want to ask this question: why this way? Why are we using a resolution like this to educate, our legislators? Why is this a strategic and a good plan to have?
Yeah, so I can answer this question, and I will also answer Julie's question in the chat kind of at the same time. So I think that this is a really great tool to educate lawmakers because, as Shelley has already pointed out, a lot of people just have this 1980s version of what HIV and AIDS is in their head. And it's not really a topic that's come to the forefront recently. We've had all of these really exciting scientific advancements. We know a lot more about treatment options. People are living full lives. And yet our lawmakers still have this very small kind of caricature of like what someone living with looks like and what their daily life is like and what those outcomes are like. And so this resolution is really a good starting point. One thing that's super important to know about lawmakers is that it is way more valuable to go to lawmakers with something. Often when you go to lawmakers, they'll go, okay, but like what bill are we talking about? And so actually having a piece of paper to be like, this is the topic and this is what we want you to do with it, having that specific ask is really, really valuable. And so this specific piece of paper kind of serves as the vehicle to get that movement going, to kind of like have an excuse to schedule those meetings. And as for Julie's question about why Representative Liston, Representative Liston is just honestly a wonderful human being that I have gotten to know very well. And she is a kind and caring person who knows a lot about public health. She is also actively a doctor. So she works at Nationwide Children's Hospital in the pediatric department. And this is just, she also has her master's of public health. She's really just like an expert in the legislature about everything to do with health and hospitals. And she's on health committee. And so this was kind of just a natural fit for her. And she was just very willing to work with us on this legislation and has really strong connections with people across the aisle too. She's done a lot of bipartisan legislation in the past, even on topics like insulin and the coronavirus in Ohio. So this was kind of just a natural fit for her office, I think.
Thank you so much for that. So this is an amazing opportunity. So I want to know right now from the two of you, what do you believe is next with this? We're looking to introduce this. How else can we, people that may not know how to navigate the state house? If you don't know how to navigate the state house, check our last webinar on our YouTube. We had a detailed understanding on how to participate there. But what do you think is next for us here in this room? How can we better help modernize these laws? Shelley, I'll start with you. What do you think we can do? Just practicality, maybe not in the weeds. Just tell us how we can move on the ground.
Get involved. Get involved in some, finding out about HIV and AIDS. Finding out about Ohio's, because we have a lot of information here in Ohio. I guess just I don't really get I'm on the ground floor, so I'm usually doing the work. I like when people come up and ask questions, find out about what the law really in details, and about World AIDS Day. Find out, read up on some information on that. There's a lot of information. Just don't watch Philadelphia. So, people think they can get everything from one movie and that's it. No, there's a lot more information out there than a lot of people. There are a lot of people who have been affected by it. Educate yourself on it.
Shameless plug, go to ohmodernizenow.org and see all of our resources about how you can support.
Yes.
I love the Philadelphia conversation because that kind of scared me when I first came out. Katherine,
scared straight, really.
Katherine, speak to us as one who is an advocate in many health spaces. What's next for what we're doing here? How is this showing up?
So I think the first thing that comes to my mind as someone that has done this for a lot of different issues is actually thinking about the dinner table conversations that you could have in your life. And what I mean by that is I think that people really forget how important it is to like have conversations with people in your network, people that you know, people that you love. And specifically about this issue, actually, talking about people that are in a different generation than you are. Because for me, I'm 24, my age group and younger has a very different conceptual idea of what HIV and what this topic entails. And so I think that there needs to be a lot of intergenerational education as well. And so if there is a youth in your life, just like talking to them about your lived experience is a little like way to chip away at that stigma and grow more understanding just like within your own personal life. That is advocacy. First of all, like you're having conversations with your friends and family's advocacy. The next step up from that is really sending your email to a lawmaker. And I really encourage you, even if your lawmaker is a Republican, do not be scared of them. Republicans are not scary. They're people, they want to hear from you, especially if you are in their district. So Julie, I did see your question about reaching out to your lawmaker. Yes, please email them. And you can do that directly from their website. So if you go to the Ohio Legislature website, pull up your lawmaker, underneath their bio, they will have like a contact me section. It's a form, fill it out. My cheat sheet for this is if you know your representative's number, so like you're in District 1, saying Representative 01 at ohiohouse.gov, that is all of their emails. So no matter what your representative number is, if you use that formula, you will get to their email inbox. Pro hack. And so I really suggest just honestly, the best formula for this email is, hi, my name is so-and-so. And then talking about your story, even just in like 2 to 3 sentences, minimizing it and, you know, really getting into the deep of the details of who you are, and then talking about the resolution and saying, thank you for your consideration. I'd love to meet with you. There you go. That's your email. That's all that it has to entail. And so I really encourage you to send the first one because like that first email is the first step. And so those are 2 things that you can do right now. Posting on social media is also always good. I think that people get like frightened of social media because it can be like a really dark and intimidating space. But screaming into the void about issues that you care about actually does work because it puts a public face on it and someone knows that someone that they know cares about this issue. Often with issues like this, especially ones that carry a lot of stigma, people go, well, I don't know anyone that cares about this issue, so why should I care about it? And just being that voice of someone that is someone that cares does make a difference. It really does, especially to communities that don't usually think about this issue. So those are 3 things you can do right now.
That's so amazing. So as you already answered some questions in the chat. Julie also said that she's a part of a political Facebook group. So I want you to respond to that. But first, can we have a conversation about why the Republicans and the support, it's not as much, or how do we get it? Let's have a little bit, just a quick talk about how we can navigate this with Republicans, since you've said, they are people just like us, and they're leading our districts.
Yeah, I mean, look, the basics of this issue is that it's not a no, it's a I don't know, which is a very different place to start from than I think a lot of people are familiar with. I know that in the LGBT community, we think about ourselves as like kind of a hot topic sometimes. And I want to make it very clear that on this issue, that is not the case. It truly is an I don't know. And so those touches and reaching out, it really does matter on issues where that is the case, like a lot more than I think that people think. My own personal example of this is that in my other life, I work on insulin legislation. And when I first went into that role, I was like like obviously it's going to be a no. And it ended up being an I don't know. And now we have a bipartisan bill moving through the legislature. So like those touch points really do matter, because you never know who's going to be your champion. And just like saying hi. And the other thing with lobbying is always every single conversation that you have, it's never a solid no. Like it is a bridge. It is a new introduction. It is meeting someone and saying hi. And even if they say no to you then, that no is not permanent. You can continue a relationship. You can see them in the hallway later. You can send them an email. And that consistency is really what matters with lawmakers. Because that no could be a yes in 2 years. And that yes matters a lot. And so don't give up, even if it is a no at first. It's really about like building the relationship with people.
So your voice matters. Everyone here, all 50 of y'all that's watching or so, I'm just saying, your voice matters.
I've seen a couple people on that list that I do know that they'll be out in the community, and I'm definitely going to have a conversation with them. Because I mean, you nothing happens without a conversation. Nothing happens.
So, Katherine, I got a question for you, but also really quick, can we give some advice to Julie? She says she's in a political Facebook group in her area, what sort of information should I share with them? Then we have a question from Francesca.
So I think the first thing is really actually think about it like that initial email that I was talking about, say your name, introduce yourself. I think anchoring yourself as a part of a community is really important. So saying that like you are someone that you're in the community, right? Like you're a part of this, you live where they live, you experience the same things as they do. It can be really humanizing. And then again, 2 to 3 sentences about your experience. Say, I'm a person living with. If you're not comfortable sharing that information, simply stating that like, that there are members of your community that are living with, and that this is something that is present in your community. And then doing as simple as like linking to the OHMM website can be super helpful, just so that people can get that initial introduction. So if you want to do this is a topic that I care about, and this is where I can find more information about it, that's always a good Facebook post, like initially. Or you can always link to the actual resolution. You can give facts and figures about World AIDS Day. Like there are a couple of variations, but all of those variations work.
Thank you so much. We have a question. It says, Katherine, how can you help advocates talk up to their legislators? It is also important to note that many people living with HIV have a high school diploma or less qualifying degree. So those with formal education are able to possibly share the importance of modernizing the laws. Many people with high school education or less feel legislators don't care or want to spend time with working ones that don't measure up to their level.
Yeah. So this is a really great question. Thank you for asking it. So what I think needs to be kept in mind about lawmakers is that lawmakers look very fancy. They look very put together, but they're people and they are not experts on everything. They require constituents. They depend on constituent knowledge to know things. And that is the thing that I have found can be really empowering to advocates. Because like these people don't know. They don't know. They don't know your story. They don't know what you've been through. They aren't topic area experts, but you are, right? And it's important that when you go into a room, you carry that lived experience confidence, because they don't have that on you and they never will. And that your voice in that conversation, just like holding space in that room, matters to them. They will see that. They will see the fact that you are present and coming to them for this issue. And yeah, like it is a little bit intimidating, right? Going into that office and like, I don't know, when I was in college, I used to do this and like go into the office and it would be like this scary white man standing behind this large desk, like looking at me. And honestly, just like showing up and being like, no, like I'm here. Like you're gonna look at me, like we're gonna have a conversation about this. That matters. It makes an impression. They notice. Because just doing that is an act of bravery. It's like an act of being seen, and it is so incredibly important. And so even in moments where it's like kind of a lot and really intimidating, you deserve to take up that space because you're the expert and you go in there with that knowledge. And I think you'll find that it works out.
That's some expert advice. So we're nearing our time. We still have time for conversations here. Let me read the chat. It says last night on Buckeye Flame, statewide LGBTQ plus online magazine storytelling event, editor founder Ken, I like Ken, highlighted the story about HIV criminalization. Anyone can incorporate the HIV crim message into any event, any conversation, any collaboration. Great point, Brooke. Exactly. And you know, as one who's a faith leader, I always love the storytelling effect. Storytelling effect is one of the greatest things we can ever do. And many of us who are lived in less resource populations, we have that in spades. We know how to tell a story. We might not be able to write it down. We might not be able to articulate it in the ways and, you know, all the, you know, language that, you know, some other of us can speak, but we know how to tell a story. And that telling that story is important. And I love, Katherine, what you said about having that lived experience vibe, right? Francesca, I know you have that lived experience vibe. You walk into rooms and you command rooms because you're like, I've lived this. And I want to speak to people who may have anxiety. I deal with anxiety many times. People don't think I do, but I deal with anxiety. There are other ways, and there are people who can help get your stories out. I know for sure OHMM, we do blog posts, and we will help write your blog posts. We will take videos of you having conversations. We will take your testimonies. We will work with you about getting your voice out there, because it is very important that your legislators, the ones who you have voted into office or may not have voted into office, but they are in office to serve you, hear about you as well. So Kim, you said that Michael has a hand up. We're going to have another question coming to the chat, or a comment coming to the chat. As we do that, I want you all to think about what last statement, what last 10% can you give to our viewers here, and to those who are commenting in our chats on YouTube, on Facebook, on all the platforms, about how, just to kind of sum all this up for you. And then I'll get the question from Michael, and then we'll end at that note. So Shelley, I want to start with you, because I love hearing you talk. So tell me the last 10% about what's going on here. Oh, real quick, Jerry said, make your lawmakers know that you are a registered voter.
Yes.
That's the vibe.
Yes.
That's the vibe in 2022. For real.
Yes.
Go ahead, Shelley.
I was going to say something about voting too. So yes, I'm with Katherine. Reach out to your legislators, get involved, learn more about your community, educate on what OHMM is trying to do. We're not trying to get rid of the law. We're trying to monitorize. I can't even speak today, but that's what we're trying to do. I'm so grateful about the people that I'm working with to help do this. I truly am, and I'm excited to see what's coming up. I mean, I'm excited to see what's next. I'm ready. It's been 27 years. I'm ready. So I'm excited to go to that next level of getting things changed and up to date. I'm excited about that.
Shelley, I'm with you. Let's do it before 2040, so I can have a little time.
Please do. Please do. Please. Like I said, I think this is a time where a lot of the lawmakers are on point, are on a spotlight, and this is the time to really reach out to them. And like I said, I'm going to be reaching out to a lot of mine, and hopefully working with Ohio Modernization closely, and moving on. We have to get this done.
Yes, we do. Katherine, last 10%. I saw you in the chat sharing that, what you call it, super hack, what the young folks say. Tell us about that last 10%. What can we take away that's really good from what we said today?
Yeah, so first I will answer a question that I saw in the chat just shortly. So sponsor testimony, what is sponsor testimony? So in the committee process, when a bill gets assigned to a committee, sponsor testimony is the very first hearing that a bill receives. And this hearing is kind of like the sponsor or the person that is behind the bill. So in this case, it's Representative Liston. She will go to the committee and tell the committee why the bill matters, basically. She'll talk about it. She'll talk about why it's important. And she will also answer questions from the committee. And so it's just kind of like the very first introductory hearing that a bill will get. And all bills get this hearing, whether it's a resolution or whether it's legislation, all bills get to be heard in this way. My last 10% is that this is a thing that could happen. Moving bipartisan HIV legislation through the Ohio legislature is realistic. It is something that could happen. And this resolution is really the first step in getting to that goal. It is a great education tool. And if you reach out to your lawmaker, it is the piece of paper that you can set on the table to use to talk about this issue. And even like we did in this presentation, going line by line, it's really just kind of a guide on why this legislation matters and how you can talk about it. And so I highly suggest that you email your lawmakers, have those good dinner table conversations, and always remember that you have expertise, no matter who you are or where you come from, and that you should always bring that confidence into any room that you go into, because it does matter.
You are the lived experience, darling. So I just want to thank you. I want to thank Shelley so much for being here. Thank you, Katherine, for being here as well. I do want to thank everyone again for being here. If you have any questions, we will ask that you reach out to Kim at ohmodernizenow.org. And we also have a physical address that's on the screen. We're going to hang out a couple of moments and let you grab all this information that you want to grab. But we want to thank you for being here for our monthly webinar, and we'll see you next month. Bye-bye.